Hi, I'm Paul Mears, Chief Executive, and I'm just going to give you an update about what we discussed at our June board meeting. We started our board meeting with a patient story, and this month we had a patient who come along to our board who had been a patient under our cancer services team and been through a variety of different departments in the hospital, and was just giving his experience not just of what it was like to be a patient given the diagnosis of cancer and to have to go through the various treatment regimes in the hospital, but also how on an ongoing basis living with cancer has become very much like living with lots of long-term conditions and illnesses, and how a collaboration between GP, hospital doctors, nurses and others is so important, and it absolutely resonated with us in terms of what we're trying to achieve with our Symphony programme in making sure that we join up care between hospital services and GP services. So it was a really good patient story to hear, and some great feedback about the care that patient had received here at the hospital. It was also the first board meeting for Dr. Katherine Patrick, who is our new Director of Primary Care. So Katherine is a GP locally at Riles Park Medical Centre in Yeovil, and she's now working a day a week for us at the hospital, looking at how we can improve our relationships with GPs locally, solve some of the problems that we know exist about communication between hospitals and GPs, but also to bring feedback from GPs into the hospital about what's going on in primary care. So it was great to have Katherine there at our first board meeting. We also discussed at the board feedback from our recent well-led inspection by the CQC and NHS Improvement. CQC and NHSI are our regulators, and they, for the first time, are looking at how they assess services jointly between them. We were a pilot site a few weeks ago for an inspection by the two regulators, looking at how the organisation was led and managed, and how we manage things like risk across the hospital, how we looked at managing our finances across the hospital, and really just understanding how leadership works not just at the board level but right down through the organisation. We talked as the board about the feedback we'd had indirectly from the CQC and NHS Improvement, and we're waiting for the formal report to come probably towards the end of July, which will give us feedback. Should just say this is a pilot inspection, so it's a new way of working that the CQC and NHSI are using. So as a consequence, it won't make a difference to our rating following our CQC inspection last year, but it's a good opportunity to test out this methodology, which will become the way in which the CQC and NHS Improvement expect us into the future. We also talked to the board about recent work we've done with NHS Improvement looking at our mortality rates. We'd had a bit of a concern raised to us by NHS Improvement that the data around our mortality showed that we were seeing higher numbers of people dying in hospital. What was quite interesting was when we tracked that information back, what we established was some of this was how we were coding episodes within the hospital in our new IT system, and also how we're reporting data up the line. I think it showed to us how sometimes data and information, if they're not recorded accurately in the first place, can cause all sorts of concerns being raised down the line which actually don't have any foundation, but do require quite a bit of work and energy to try and dispel any myths that may have grown up. So it was useful that Tim Scull, our medical director, was able to update the board and reassure the board that absolutely there is no concern around the current mortality rates in the hospital. Indeed, we are performing with it along the national average in that regard. As you'd expect, we talked also about finance. It's a particularly challenging financial climate we're operating in within the NHS at the moment, but we have done well so far this year. Having said that, there are some significant challenges facing us in the next few months, and we're talking to business units, clinical directors, matrons about the challenges we face and how we can try and carry on building on the work we've already done to deliver our financial plans for this year, which will be a significant challenge, but one which I know everybody is very alert to within the organisation. Finally, we had an update also at the board about how things are going with Symphony Healthcare services. Many of you will know this is the company we have, a subsidiary company of Yeovil Hospital, which is now running GP practices within the local area. We have 4 practices within Somerset now run by Symphony Healthcare, and another 2 have recently joined, and we're expecting further practices to join us over the coming months. It's a really great opportunity to look at how we as a hospital support our colleagues in primary care and make sure that we have a sustainable primary care system locally, given the importance of the linkage between hospitals and GPs. It's a really important strategic move for us, and it was great to hear how that progress is going within Symphony Healthcare and the positive impact we're already having in those primary care practices. So it was a busy board meeting, a lot to discuss and cover as always, and if you've got any questions about anything you've heard, please drop me a note and get in touch. Thanks very much.